continuous care, redesigning healthcare. If I was to ask you, how do you imagine healthcare today? What would come to mind? Maybe, when you feel awfully low, you go to the doctor, and, most likely, they will prescribe a pill, or some other type of prescription drug. The answer to care in the future is not a hospital, and it is not a pill. Why? US healthcare is the largest and most resource-intensive in the world, but it is unable to provide the clinical solutions to our 21st century diseases, such as diabetes, heart disease, asthma, depression, and obesity. These are known as lifestyle-related diseases. The places where people live, work and play have an effect on their mental and physical well-being. Physical activity and proximity to nature have been designed out of daily living, leading to chronic diseases, which cannot be clinically cured in a hospital, but a sustainable community which promotes wellness. Hagen Island, in the Netherlands, is an example of a community which prioritizes people and encourages exercise. By splitting the housing bars, a more open, garden-like environment appeared. Units are positioned at various locations on the existing plots to create a series of cross views that increase communication, open areas, and social opportunities. As the main concern was child experience and safety, this island is predominantly walkable, and the paths are covered with a soft material, which makes walking more pleasant and less dangerous for children. Here is a graphic representation of obesity trends among US adults from 1990 to 1998 to 2007. Note the steady increase in Florida alone. This is an example of preventable hospitalization from asthma in Florida from 2011 to 2013. The Florida average was 135 instances, while Miami data was 120 to 150 instances. There is a lack of common language among planning and healthcare professions. Since many designers look to the leadership in energy and environmental design, LEED, as a means to achieve a sustainable design, I propose an amendment to LEED plus neighborhood development to integrate design guidelines for continuous care. Certification programs like the Living Community Challenge and BREEAM focus more on conserving materials and have one category for health. I intend to invert this tendency and rather these amended guidelines focus on health and well-being. The guidelines will include categories such as prioritizing people, installing public art, preserving natural landscaping, and encouraging physical activity to address the issues of heart disease, asthma, depression, and obesity. The site will be the new downtown Doral. With more than 120 acres of retail, office, and residential towers, this demonstrates a significant growing interest and investment in the city. As a growing city, expecting to see an increase in population of all ages, downtown Doral will be the testing model for the guidelines for continuous care. The design will concentrate within a 5-minute walking radius from Main Street and the Paseo Doral, as those would be the streets with most pedestrian attraction. There is an increased awareness that health is not just the absence of disease, as well as a growing demand for healthy environments. Designers and clients already look to LEED for a sustainable design plan. LEED Neighborhood Development can be the carrier for the guidelines for continuous care, and downtown Doral will be the model to aid in its creation. By using the widely popular LEED platform, the principles for continuous care could be spread among designers and bridge the gap between urban planning and healthcare.